Yeah, I mean, I think that the college hasn't taken anything off the table in regards to what's possible. And so, each day, literally probably each hour or two, we're revisiting the best practices and the advice that we get from public health professionals and trying to make decisions based on that information. So that is a possibility, but that's not a decision that the college has made as of yet. Yeah, our intent is to provide housing for students, particularly because we know that there are populations of our student body that don't have other places to go. And so we would do two things in that situation. One is communicate clearly and collect the names of those students, ensure that there's good communication with them. And the other is to take whatever precautions we would need to take to ensure their safety as well as the safety of those that are in the campus community. That's a great question. I mean, I think it's really important for all of us, right? Faculty, staff, and students to support each other. I mean, I think that right now there's a lot of conversation about the public health impacts, but there's also appreciable impacts to individuals' health and mental health. And so I think that students and student leaders in particular need to find ways to support each other in those decisions and in those situations. And so that's what our staff has tried to do with each other, is to be supportive and be encouraging, and not fall victim to a narrative that I think is counterproductive to both individuals' own health and mental health, as well as to making good, sound decisions. Yeah, good question. So I think that there are a couple steps we would encourage. One is if students are not feeling well, they should call the NOAA Health Clinic, or if it's after hours, they should call the Waverly Health Center. The second thing is if they do then visit with the NOAA Health Clinic and they meet those criteria, and then the clinic and the clinicians feel like they need to provide a test, they'll be given a test. And so there is that process in place. I think what students also should know is that we're fortunate to have a health clinic on campus, right? And I think students may not know this either, but the NOAA Health Clinic is part of, the Waverly Health Center. So they're connected. They're actually, it's a operation of the Waverly Health Center on the campus of Wartburg College. So it's a bit of a misnomer to say like NOAA or the Waverly Health Center, because they're related, and they're working hand in hand. And those are also the folks that we're getting our advice from and getting our expertise from, as well as the resources that are online from the CDC and public health, et cetera. Yeah, so I think, there's probably a lag or maybe a disconnect between that statement and then the reality of actually providing the test for free. You know what I'm saying? Like, so I don't know that the college would want to make a statement about something that really the CDC should be taking the lead on. What I would say is that we already, even prior to that statement, had a process whereby students would get the test if it was necessary and needed for them. And then again, like, there's been in place tests for things like the flu as well, right? Like, and I think the part that students need to be vigilant about, and it sounds almost too simplistic, but if students are not feeling well, they should go to a medical health professional, and if that professional believes they should not be attending class or attending events, et cetera, that they should take those precautions. And the second is that, if they have questions, they should really try to rely and reach out to people who are experts that can respond to those questions. Yeah, and not only the viruses, but we've also, even thinking back to 2008 with the flood and our response to that, like this has elements of a crisis, right? And so what the college has done is put in place a response team, And so we have a communicable disease response team that's chaired by Stephanie Newsom because of her expertise and because she's the liaison to the Waverly Health Center. And so she has gathered with then others that have expertise, right, from cleaning to dining to residential life to communications, et cetera. So that team has been gathering and making decisions and making efforts to really provide, more safety, more security for our campus. And at the same time, our senior leadership team, our cabinet, has gathered, and had conversations, probably about every half hour, via email or texting or whatever it might be, to make sure we have the most recent information and then to make sure we have a clear line of communication. Yeah, I guess the only other piece I would add is that the college also, in our last communication, pointed people to a website. And so, I would encourage people to utilize that resource, which is where we'll be publishing additional updates as they come.